stabilize the distal tibia fibula, grasp the calcaneus, okay? And then I'm going to try to slowly try to draw the calcaneus, but with it the talus anteriorly out of the mortise. And if he says ouch, what do I say? Where? If you don't say where, people, I'm going to be patient, but eventually I'm going to say, are you a mind reader? And eventually you're going to say, are you a mind reader? Eventually you're going to say that, hopefully. And I'm going to say, then how did you know where it hurt? I said, well, right? Ask. They will tell you. He's going to point right here in the sinus tarsus, that little depression, which on our right ankle, excuse me, is 4 o'clock. Everybody agree? That's where it is. So next is going to be lateral talar tilt. Okay, stabilize, maybe come out just a little tiny bit more. Stabilize the distal tibia fibula, grasp the calcaneus, and I'm going to tilt the talus laterally, which is also eversion, which is also valgus, right? And I'm going to stress like that. If he says ouch, I say where? He's going to point to the deltoid ligament. Okay? So on the lab exam, have you already palpated the deltoid ligament? Yes? And he's already said ouch. Now you do the stress test, he says ouch again. That's going to help you confirm that's the problem. Then I'm going to do the medial talar tilt, test the lateral ligaments, stabilize the distal tibia fibula, grasp the calcaneus, and with it the talus, tilt it medially, stressing the lateral ligaments. Everybody good? So now come off the edge, the external rotation stress test. So now, stabilize. So the picture said way up here. I just don't think I have good control. I'm going to grab it more mid-shaft and put my hand on the heel, my hand and forearm along the medial side of the foot, and keep the lower leg still, externally rotate. People, that's a very accurate test. He says that hurts. You can bet the house has a high ankle sprain. Okay, so scoot back just a little bit again. He's going to say ouch, I'm going to say where. He's going to point way over here on this lateral side where the joint is. Right? I can't tell you how many times people have palpated the anterior inferior tibiofibular ligament and point right there. That's wrong, people. The joint is way over here on this lateral side. Don't make that mistake. Okay? So next is the side-to-side movement test. So move this side to side just a little bit. Stabilize the distal tibia fibula, grasp the calcaneus. I'm going to push the talus against the fibula. So I'm not tilting it, I'm just pushing it side to side. Okay? And then, that might hurt, where? Here. But I'm going to reverse my grip and try to push it against the tibia, but I'm trying to open up the mortise. Lastly is the syndesmotic squeeze test, mid-shaft of the fibula and tibia. Squeeze the two bones together. In theory, they're coming together. Distally, it could cause separation at the distal articulation. Fracture tests. Lightly tap on the heel at first. See if that hurts. If it doesn't, then tap more forcefully. That sends a shaft force up the long axis. Next is the compression tests. I'm going to say maybe he has pain here mid-shaft when I palpate the fibula, right? I'm going to palpate the whole length of the fibula. I'm going to squeeze the two bones here. In theory, if they're compressing here, down here they might bow a little bit, and that can cause pain. Now I'm going to come down here and squeeze again, and see if it produces a bowing effect. And then lastly, the tuning fork test. You feel it go right up your leg, right? And the vibration gets to a fracture site, that can cause pain. Then you can lay on your stomach for the Thompson test. Foot has to plantar flex, people, right? Now, on the lab exam, it's going to plantar flex, but he's going to say what? Ouch. Have I already palpated the Achilles tendon?
Yes.
And he said ouch. When I do the active and passive range of motion tests, are those going to be positive? Yes. When I do the manual muscle test for the Achilles tendon, is that going to be positive? All those things are going to help confirm. And the last thing is you ask them to do a toe raise. Okay, the rest of the time is your time.